Today we have two presentations. First, we will have Dr. Jerry Cox and Miss Alexandra Cayley, and they will be discussing community living centers at the VHA. And then we will move into another presentation with Miss Lotta Cameron and Miss Tamik Delise, and they will be discussing Dublin VAMC and how they use Get Well to reduce patient falls. And Jerry and Ali, if you guys are ready, you guys can take it away.
Great, I am ready. Good afternoon, everybody. It's a great pleasure to be with you this afternoon, and thanks for joining. As Nina said, I'm Jerry Cox, and some of you may have known my name when I was working at the VA at Central Office for nearly 11 years before I retired at the end of 2024. In my last several years, responsible for all of the quality and patient safety and performance measurement and data analytics functions at Central Office. And now enjoying retirement, but still very much interested in furthering quality care and safety of care for veterans. And so that's why I'm really glad to be with you all today. Ali, thanks for joining. It's nice to see you as well. Ali is the Chief of Community Living Centers in the Program Office at VACO, the Office of Geriatrics and Extended Care. And so I'm glad you're able to join us today.
Yeah, thank you so much, Jerry. Hi, everyone. My name is Ali Cayley. As you said, I'm the chief of the CLCs in the Office of Geriatrics and Extended Care, and here to talk to you about overall some general information about CLCs. And the priorities. So I'll turn it back over to you, Jerry. You had some questions you had?
Sure. Before I get to the questions, though, I wanted to start. Anybody who heard me present when I was working at VA knows that my presentations were typically punctuated by poor attempts at humor. I had a reputation for telling really bad puns. In fact, my team even gave me this little gift when I retired. It's the Dad Joke 3000. Just take a listen.
Librarian, if she had any books on paranoia, she whispered, "They're right behind you."
That's the kind of stuff I'm talking about. So I thought I'd just mention that it's been extremely cold here in the DC area. We had a snowstorm last week, 6 or 7 inches of snow, followed by sleet. It's still completely white outside because the temperature hasn't broken freezing yet. And that reminds me that my wife gave me this beautiful cashmere sweater for Christmas last year. But I kept picking up static electricity and I kept getting these little shocks. So I had to return it to the store. And the clerk at the store was really nice to me. He gave me another one with no charge. Wish I had a rim shot. All right, a couple of happy faces coming up. You guys are paying attention. All right, with that as a very poor introduction, I do want to talk to you, Ali, about some of the current initiatives and priorities of the Office of Geriatrics and Extended Care, particularly regarding CLCs. So, as we're talking today about enhancing the veteran experience and enhancing quality and safety of care, what are some of the ways that CLC leaders are working to make the veteran experience better?
Yeah, thanks for that. Well, before I jump into that, just to give a little background about CLCs. So, the Department of Veteran Affairs owns and operates a total of 133 CLCs nationwide in all states except for Alaska, Rhode Island, Utah, and Vermont, and New Hampshire, excuse me. CLCs provide a dynamic array of those health and rehabilitation services in a person-centered environment designed to meet the individual needs of veteran residents. And then our mission in the CLC is to restore each veteran to his or her highest level of well-being. It's also to prevent the declines in health and provide the comfort at the end of life. So one way that CLC leaders are enhancing the veteran experience is by embracing resident-centered care and cultural transformation. This is creating an environment that it functions as real homes and where daily activities are scheduled around the veterans' preferences. Staff aim to provide CLC residents with veteran-centric approach and help them maintain and attain their optimal functional abilities. So some examples include resident-centered care identified in it's driven in the treatment plan, includes their preferences, what matters most, and also includes the lifelong habits of the resident. Additionally, care is individualized to each resident. The resident is an active participant in his or her care whenever possible. And then attention is paid to ensure that the care meets the age-appropriate cultural, religious, and preferences of each veteran. So really, that's the main thing, is embracing that cultural centered care and cultural transformation. I'm sorry, resident centered care and cultural transformation, and really adopting that veteran first mentality, veteran centered care.
That
It's
is a
one way
wonderful
they're
philosophy.
enhancing. Yeah.
So, what about goals for quality of care? What is GEC promoting? Any specific programs or initiatives relating to improving quality for CLC veteran residents?
Yeah, so I mean, we've really adopted, the resident or veteran first, resident centered care. So, and part of getting that is through the resident satisfaction survey. And we have a national standardized survey that's available to all CLCs, called the V Signals CLC Resident Satisfaction Survey. So this is an anytime survey that's designed for CLC veterans to provide their real life experience and their perceptions on the care that they're receiving in the CLC. So, and this is available to CLC leaders, and they can, take that data and make quality improvement efforts. Additionally, we see this data on a national level, and it's showing, overall that the trust in CLCs is high. So the other piece, the other priority, in addition to the veteran first and resident satisfaction, is really ensuring a safe environment for the resident, which that includes, preventing falls and accident prevention and whatnot. So one of the focuses too is overall fall prevention in CLCs. So we're focusing on both of those two areas.
Ellie, what are some of the ways that you're working to reduce falls?
Right now we have several different resources available. So we have national education and resource guides. We also have our national, what's called the CLC's ongoing National Center for Enhancing Resources and Training, also known as CONCERT. CONCERT that's available to offer coaching services to individual CLCs if they're having or want additional assistance with their falls. They have a numerous evidence-based resources that they can help and work with the CLCs. Additionally, these resources are available on our CLC SharePoint, all about fall prevention and different, really getting down to when the veteran falls, why did the veteran fall? What was the unmet need of that veteran that led to their fall?
Terrific. Yep, and I hope that people are taking advantage of the patient safety reporting system as well, so that at the system level, as well as at the national level, we can work on identifying those factors that contribute to falls and finding ways to reduce them overall. You mentioned the satisfaction survey, the V6 CLC resident survey that you perform, and you said that the scores are high, the trust is high, and satisfaction seems to be high among veteran residents. What's the trend been over the last few years?
Well, it's a newer survey, so we're still just beginning to review the data. So I don't have that information right now. I just know that generally that right now it is high. And once as the survey came out just in 2024, so we are just in the process of getting it widespread across the country.
Perfect. Well, I'm sure you could be looking at trends as you continue to use
Yes.
that over the next few years and hoping to see steady increases.
Yes, most
We know
definitely.
that the veteran trust scores overall for VA, and not just VHA, I'm talking about veteran services overall, reflected in increasing trust scores over the last several years, which is pretty remarkable considering that we got through a pandemic and all of the usual ups and downs with regard to your annual budget concerns and so forth. So I wish you continued success.
Yeah, thank you. Me too.
Anything else that you wanted to share with our audience about any particular initiatives or priorities for GEC right now?
I don't think so. I'm looking forward to Dublin has a project that they're looking for or to describe their efforts for improving this. So um,
Great. Well,
interested to
then
hear what they have to say. Yeah.
let's turn it back to Nina and she'll introduce our presenters from Dublin and we'll all learn more.
All right.
Awesome.
Thank you so much.
Thank you both. Really appreciate that. Definitely a good insight to see what the GEC is doing. And thank you both for participating today. We appreciate it. Carl, are there any questions in the Q&A box for us?
There's no questions as of right now.
Okay, awesome. And at the end of this presentation, like I said, there will be a survey. And if you'd like these slides sent to you with this contact information, just go ahead and leave your email and I will send that over to you once it's processed. And now moving on, we'll pass it over to Dublin, Miss Lotta Cameron and Miss Tamika DeLise. If you guys are ready, you can take it right over.
Good afternoon, everyone. My name is Tamika DeLise. I'm one of the nurse managers here at the Call Vincent VA. And I'm also a veteran, so I'm happy to be here today to discuss what we're doing to increase safety for our veterans. The Carl Vinson VA Medical Center has been improving the health of veterans living in Georgia since 1948. They're located in Dublin, Georgia, of course. Carl Vinson VA Medical Center is on 75 acres, and we have 265 operating beds. 145 of those beds are CLC beds, 10 are med-surg, and 110 is domiciliary beds. The Get Well Network started in Dublin. They went live in November of 2024 for the CLC, and they went live in July of 2025 for the domiciliary. Next slide. The staff rounding survey. So we realized there was an opportunity for improvement here at Dublin. So we asked the question, how can we increase bedside documentation and monitor hourly rounding for residents who have had multiple falls? The solution: in June of 2025, the Dublin VA partnered with Get Well to create a custom rounding survey on the TV that focused on the 6 Ps. Staff are able to complete the rounding survey on the resident's TV using a pillow speaker. The Get Well is able to track the time and date of each survey submitted by staff and record when staff are actually in the veterans' rooms. And to your right, you'll see an example of what it looks like. That's exactly how it looks when it's on the residents' TV. Next slide. We developed the criteria for all the veterans to meet the program. Number one, for new admissions, they're on the program for 72 hours. For new falls, 72 hours. Also, 5 veterans that returned away sick from the hospital, they're on for 72 hours as well. For 2 or more falls within 14 days, they're on for 90 days. More than one fall in a month, 90 days, and more than one fall in a quarter, also 90 days. We instruct our employees to highlight the veterans that are on the program in yellow on the assignment sheet. We assign staff members to complete the hourly rounding tool via the Get Well Network, in addition to their Caribou documentation. So we don't negate that. We complete the All About Me forms, and they're placed on the veterans' closet in their room, the closet door. We also complete the false tips and post that in the veterans' line of sight so that they can review that at their leisure. We also add the veteran to the watch list huddle with interventions, until the interventions are effective and outcomes improve. Note, the project does not take place of the post-fall huddle process. The post-fall huddle documentation, notifying the provider, the JPSRs, and the post-fall huddle are still completed. It doesn't take the place of that. Next slide, please. Okay, these are images of exactly how it looks as the staff are assessing the survey. The Quick Care provides staff additional access to leverage tools typically used to engage residents and families in their care at bedside. So number one, they access the Quick Care by bringing up the on-screen controls via the menu button on the pillow speaker. Number two, they enter the hospital-specific code. This one is 1234. It's something really simple. It's on every single CLC unit. The code is the same, so it's universal. So if any of our staff go to another unit, they would still use the same code. Number three, we select staff only, and the survey is located under staff tools. So that's exactly how it looks as it's pictured right there. Okay, the 6 Ps. So once they're in the room, the survey consists of the 6 Ps. We ask the veteran if they're in pain, if they need to use the restroom, or if they have a Foley catheter. We perform Foley care. Their personal belongings, we ask the veteran, is there anything they need as far as their personal belongings? Are they within reach? The phone and different things, the call light, of course. Position, we ask the veteran if they need to change positions. If they're on a Q2-hour turn schedule, then we would take that time to turn them as well. Pumps and IV sites. Did you evaluate the pumps and the IV site? Are the bags, the IV bags full? Are they empty? Is it the right medication? Is the IV site infiltrated? Any phlebitis noted, things of that nature. And the last but not least, I feel like is really important. Did you promise to let the veteran know when they can expect the next check-in? It's very important to let them know that we're here and we're available to help them with any of their needs. I will give the next is my colleague, Lotta Cameron. Thank you.
Good afternoon, everyone. My name is Lotta Cameron, and I am the Quality and Performance Improvement Coordinator at the Carl Vinson VA. So on this particular slide that you're looking at is the validation of our hourly rounding outcome. One of the things that I have thoroughly enjoyed is that any resident who has had multiple falls, I can go look at the room number and I can go to time started in the column and time completed. And what I've been able to do is I've been able to peruse hourly to see if a veteran who have had multiple falls, if that veteran was reviewed. So this is just a sample of what that information looks like, as well as with the questions that are listed up there. Next slide, please. Okay, so validation of hourly rounding which is continued. So anyone can review this. So nurse managers can receive alerts in real time via their email. Data reviews allows us to identify trends and opportunities for improvement. Example, hourly rounding on a weekend not being done. Another trend it would show us is if they are rounding every 2 hours during the night. That would give us a great view of that, or if they're missing the rounding at the change of shift. The Get Well CSM reviews data post-fall to see if rounding actually occurred prior to the fall. And so over here, you do see another example of the data. And that is really great for whenever we have a resident who is on our Get Well program to see if the rounding was completed prior to a fall. The other great item with the Get Well network is that it increased bedside documentation. So as Ms. DeLee stated, they have to go into their room, they utilize their pillow speaker, and they answer the questions there at the bedside. Bedside documentation increased by 380% since June. Staff told the Get Well liaison that documentation was only occurring in Caribou every 4 hours on a cow located outside of the resident rooms prior to the Get Well rounding. Real-time documentation at the point of care reduces errors caused by delayed documentation, and most importantly, it improves patient safety and helps with decision-making. So with that, when we started the program, we had a 66% reduction in June 2025. For all the veterans that were on the program for July of 2025, there were 0 falls from the residents on the program. Just a little side note, the CLC had 11 falls in April. There were also 11 falls in May. However, the falls decreased in June from 11 to 4. So we were pretty happy with that. Next slide, please. This is one of the slides that I am super proud of. It definitely shows as you're looking from quarter one, FY20, I'm going to start from bottom up because that's how the data is presented to us. So from FY25-01, you see that Carl Vinson was at 36.78. Then you can see for FY25 quarter two, we're at 35.49. FY25 quarter three, kind of right at that 3.4 mark. And then for FY25 quarter four, we hit the second quintile for our metrics, and we are super excited. And we are on target for FY26 quarter one to either be in the middle of the green or over to the right on that blue area. So we're super excited about it. We are very intentional with utilizing this. It is a team effort, and the program has been phenomenal for Carl Vinson. Just another side note, the Dublin VAMC in FY24 in the green, as I said before, and that's just kind of what I did the layout for. So again, we do enjoy it. It is a team effort, and we have seen great improvements.
The results have been powerful for our team. Powerful.
Yes.
You know, safety is one of the number one things that we focus on here at Carl Vinson, and we just want to make sure that we're keeping our veterans safe and free from harm.
Yes.
Do you have
Next
any
slide.
questions?
Oh.
So we actually have a gentleman, Gregory Doss, who's had his hand up for a little bit. So Gregory, I'm not sure if you're unmuted or not, but go ahead and ask your question and we'll let everybody answer it.
Sure.
I think you'll have to put it into the Q&A. Participants are automatically muted. Sorry about that.
Oh, he said it was a mistake. No problem. I didn't mean to call you out.
All right. Any other Q&A questions, Carl?
I don't see any questions. I do see a lot of comments, just congratulating you all on your work that you've done, and continue to do there at the Carl Vinson VA. There's a lot of interest in the slide deck. And so I just want to assure everybody that, immediately following this webinar, there'll be an opportunity. There'll be a couple questions that we'll ask for follow-up, but if you do want a copy of the slide deck, we do have your email addresses in the chat here, and we also on the questionnaire at the end of the webinar, just put your email in there too, and we'll send you out the deck upon completion.
One more thing I wanted to add, keeping in line with our HRO principles, this program directly aligns with it. You know, sensitivity to operations, deference to expertise. We partner with the key stakeholders to transform care at the Dublin VA. And it's been phenomenal. And it just goes to show with shared governance, with us stepping up, identifying the gaps and working as a team to bridge those gaps, we can do phenomenal work throughout VHA in totality. So thank you guys again.
Yeah, Tamika, I love hearing that because HRO remains near and dear to my heart, and I had the privilege of working together with all of you in promoting HRO principles for those last several years that I was at VA. So I'm really happy to hear that it's alive and well at Dublin.
Yes.
I do see one question that came into the chat in regards to the quick care program. And so anybody that has GetWell inpatient deployed, quick care is part of the core functionality of GetWell. And so if you're interested in implementing any of the quick care functionality, just reach out to your client success manager, or you can reach out to myself, and we can help you get that configured at your facility. So hopefully that answers your question. I think it's Jeannie Alessandrelli. If I murdered your last name, I apologize.
All right. Awesome.
All right,
any
let's
more
go.
Q&A? Any more Q&A, Carl?
No more Q&A.
Okay, awesome. Well, thank you too for that amazing presentation. Like Jerry said, that was really cool to see. And as Carl said as well, if you all are interested in learning more about this, I can send this slide deck out after the presentation, and the emails are included here. So if you'd like to reach out directly, Ms. Delise and Ms. Cameron said that that'll be all right. And that will conclude our presentation for today.